Well, back with Dr. Diez here from Tampa, Florida. How is life in Tampa, Florida, Dr. Diez?
Weather's a little rough here today, Helmut. It's the worst weather we've had, probably the worst weather I've seen in a long time. Tornadoes had tornadoes come through today.
Really?
Yeah.
It is, we do seem to have, I don't know about global warming, but climate change we surely do seem to be having.
I do have to say, though, the previous 2 or 3 weeks have been absolutely gorgeous. So,
Wonderful. Yeah. Well, Dr. Diez, let's talk about something, maybe more serious and maybe just as unpleasant, dentistry. What do you think about that?
I think dentistry is wonderful.
Oh, okay.
I don't find anything unpleasant about it at all, as a matter of fact.
Then that is good, because if our dentist finds it unpleasant, we patients are in real trouble.
I became a dentist because I actually enjoy going to my dentist very, very much. I admired him, never minded going, thought he was a great guy, and I wanted to be like him.
Well, and I have heard from other dentists, and including from you, one of the reasons you get children at very early age, couple of years kind of, give or take, is not to fix anything on them, not to even more or less check them. There's nothing to check. It's to have them riding up and down the dental chair, get them used to it, push a mirror in their hand, and they check their own teeth, kind of, and blah, 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 that type of stuff.
Exactly.
Yeah. And, of course, the instruments with which you treat dentistry is a lot better. I really do remember in my days when I was 11 years old, and the guy put, a needle in it, and he put it in 90-degree angle. It was like a pencil, in the front. It was. I think it had a 3-millimeter hole in it. Do you understand? It was a tube. It wasn't a needle. It was a tube, and he stuck it straight in it, and it was painful. I mean, all that stuff doesn't happen in Austria.
They must have done things a little differently there.
Well, or I'm really, really old. You know what I mean?
Maybe. You can look it though.
So. Let's, I have a question here in terms of dentures. Tell me a little bit about the implant-supported denture, the advantages and the disadvantages of it, because I hear a really great thing where kind of it's a phenomenal hybrid where it costs a fraction of lots of implant, and apparently it's simply just as stable. You can chew and eat, and you can taste food better. Shed some light on and tell me whether I'm right with that, what I heard.
No, you're absolutely right. You can have a full mouth of implants, but the cost is extreme. People who have dentures, they're familiar with the problems of dentures being loose, moving around, being uncomfortable, lack of confidence because they're fear the denture is going to fall out. Well, what's nice about implants underneath the denture is, for one, you don't need a mouthful of them. A lot of times 2 to 4 implants can secure an upper or lower denture tremendously. And basically what is happening is the denture is just snapping or attaching onto the implant. And like you said, it becomes a very, very secure restoration. There's no fear of the denture coming out when you're eating. There's no fear of the denture coming out when you're talking. It's a very, very tight fit. And for a fraction of the cost of a full mouth of implants.
Right. And because, when we look back at our grandparents who have worn dentures, and actually in my case also, my parents, mom, dad actually never had one, but, they start, I don't know that about my parents, but I see other people, the second they start having dentures, due to the fact that they need to be a little careful, a little bit walking on eggs, and due to the fact that they don't taste their food, because unlike that we all believe that the tasting of the food is in the tongue, which I'm sure there's some, really most of it happens in the palate, and that palate is covered with plastic, so people automatically feel handicapped. They say, that's it, I'm over. It's almost a signal of you're over. And I guess the implant denture would really because after the way you talk, after a while when the person has it in it, he'll forget that he has implants. It's kind of like he's normal, and by doing so, he will feel normal. Does that make sense?
Yes, it does make sense. Absolute sense. Yes, I agree with you.
Well,
one of the other things too that you had mentioned about an upper denture, you don't have to have that palate covered because you're not relying on. The reason we cover the palate is to create suction for the upper denture to stay in. Okay, and if you have implants that the denture snaps into, you don't have to have that palate covered. So that lack of taste by wearing a denture can be eliminated.
Right, and I think in another, I'm not so sure I think you mentioned it, that also, there's currently lots of news out there with the adhesive, the denture cream, that it has a lots of zinc in it, and it's at the gateway of the blood vessels. It sinks in very fast, and apparently, not proven, could potentially cause nerve damage, which is physically handicapped and mentally handicapped. And I think that's, nobody wants that. And with the denture implant, you can totally avoid the cream. Whether what they say about it is true or not doesn't really matter. But if the risk exists, then having the denture implant with all the benefits already would obviously be almost a no-brainer, it looks like, huh?
That's correct. It's, again, the implants are relatively inexpensive implants for a denture. And like you said, why take the risk on having health issues with a denture cream when it can be totally avoided? And not to mention, implants are going to hold a denture in a lot more secure than any denture cream that's out on the market today.
Absolutely wonderful. Well, thanks for your candidness. Thanks for your information. It's very enlightening. Thanks a lot, Dr. Diez.
Thank you.